the Ren 9, that point is called as a Shui Fen. Shui means in Chinese we call as a water. So Fen, that means is the drudge or drainage. That means the most of the water passages, water toxicity can be regulated by activating the certain points in our body. But you understand, anything is the peritoneal cavity having the distension, swelling, or we call as ascites is the water retention, or we known as the obesity, where the intracellular fluid or the muscles, excessiveness, anything related to the excessive accumulation on the peritoneal cavity, then you wanted to drain out that, certainly you can use the water passage point. That point is called as a Shui Fen. When you wanted to add up for this indication some more the points, I do suggest you, there are the point called as a Chiza, and then the next point is called as a In Leng Chuan. That point is Lu5 and then spleen 9. Both the points along with the Shui Fen always is good protocol to treat for the various edema related conditions, various swelling in our body can be treatable by activating these points. But however, Ren 9, so Ren 9, the point is the inferior hypogastric artery. It supplies at the same time, that's always is good, where we call as a ninth intercostal nerve. The cutaneous ninth intercostal nerve supplies to this particular region. So therefore always is good to treat for the known and unknown cases of the edema. But however ascites is there, we need to rule out what could be the reason to cause this problem, whether there is the liver malfunction which leads to this problem, or the which we call as a cirrhosis of the liver, or the fatty liver, or the biliary cirrhosis, or the which are called as a cholangitis cirrhosis. So we wanted to know exactly what could be the reason to cause the edema on the abdominal region. Of course, in the obesity is there, even that condition certainly you can add up without anything diagnosing by using the liver parameters. So you just activate this point, Ren 9 for the edema conditions. When we look at about the CR1, that point is known as the Ren 10 point. Right, Ren 10 point is CR1. So this point is located exactly 2 chun above the center of the navel, from the above. That means is the 2 chun proximal to the navel on the midline. This point is CR1 point. But when we wanted to treat by using this point, this point is good to treat for the pyloric sphincter of the stomach. When there is the duodenum is not functioning properly, where the bile is secreted and then stored in the gallbladder, that pass on to the duodenum for the release of the bile to do the digestion process. When the duodenum is not getting the enough bile, even that condition also you can treat by activating the CR1, that is Ren 10 point is always is good. When I wanted to tell you here, but in fact is the very key points to treat for the abdominal organ, please focus and then understand and then implement in your clinical practice. When we look at about the Chianli, that point is called as a Ren 11 point, right? So that point is located 3 chun proximal to the center of the navel on the midline. When we look at about the 3 chun below from the navel, that point is known as a Quan Yuan, that is Ren 3. 3 chun proximal to the Ren 8, that point to be known as is Ren 11 point. So when we wanted to apply this point is, of course, is the duodenum, and then is the abdominal, the stomach related conditions can be treatable. When you wanted to treat this for the people who are suffering for the food toxicity or the food poison is there, even the people who had something which leads to the nausea, or we call as the abdominal distension, bloating is there, and toxicity has been entered to the abdominal region, that time you wanted to get the vomiting. See, to induce the artificial vomiting, we take the salt water or some kind of the mucus water, so that to come out in the form of the vomiting. But in the similar way, we use this point to induce the artificial vomiting in the natural way. Once you activate this point called as is the Siawan and Chianli, both the points are good if we wanted to, if anything we had the by mistake is the toxicity is there, we wanted to get the vomiting, they should not go down to the intestine. Even that condition we can induce these 2 points. That point is REN 11 and then REN 10. Both points are good. Since it is functioning to the duodenum, from the duodenum it ascends upward direction, it comes out through the esophagus, right? When we wanted to know about the most crucial point, you understand the REN 12. This is the key I am telling you. REN 12, the point is located fortune proximal to the tip of the, tip of the or the center of the navel on the midline. So how to understand? Remember, one more key I am giving you. When patient is, we understand that is the fortune above the navel. You please remember the xiphoid process and then navel. What is the how many destination as per the proportional measurement? That means is the epigastric region from here. That means you look at the image from here to navel. So how many tunes are located here? Totally there are the 8 tunes or 8 segments are located, divided into 8. Some people having the rather than 8, some people have like a 15, some people have the 6 measurements. Maybe I'll teach you, sometimes is practically when you understand from here to here. That means this is the called as a syphisternum. From here to here is the 8 segments. Some patients, if you place it like a 4 fingers and then 4 fingers, another 3 fingers, that is totally 8 chun, right? When we wanted to see, some patients, even I have seen the whole stretched abdomen. The patient is very lengthy, is around 7 feet or 6.5 feet. So even that condition, it's not 8 chun, it is 15 chun. But the whole 15 chun, that means is not like that. First we need the whole area is divided into 8 segments. So then you just understand under that 8 segment means is the center. Whether it is the 6 chun or 7 chun or 8 chun, no matter. So just you have to understand from here to here, that means from here to here you just measure. So that means here is the totally center, you just use in this way, by using the fingers, or you just take the tape, how many inches are coming from there to there, then you locate is the center point to be called as a Chungwan. That point is REN 12. That is the move front alarm point for the stomach. Then you understand this point is working for the fundus condition. Whenever the patient feels there is a discomfort and anorexia conditions, where the loss of appetite, where the patient is feel that bloating of the stomach always, where all the functional conditions of the stomach condition can be treatable by activating this point. Whether it is this point is functioning for the stomach, can be divided into 3 junctions, the upper junction, middle junction, lower junction. But REN 12 point is treatable for the central junction of the stomach. That junction called as a fundus of the stomach. That means is the central of the body of the stomach, that can be treatable. When we look at about because of this is the move front alarm point for the stomach also. The deep energy, the deepest energy of the stomach meridian also existing in that particular region. When we wanted to activate this point, certainly this is for the diagnostic purpose, at the same time this for the therapeutic purpose also. Remember I am telling you, when the patient feels there is a cardiac pain, so that time you try to point out this point. When patient feel there is a pain on the stomach, REN 12 region, then you understand it is purely related to the abdominal gastric related conditions, which leads to the abdominal pain or the chest pain. So in that case you just understand there is a tenderness is there on that particular region. Insert the needle on that same place, or ask them to give the pressure continuously, or I suggest you to do the cupping, or we can consider as a moxibustion as well to treat for the fundus related condition. If the fundus is good, then you understand the upper geo, middle geo, the digest. Same time all the Fu meridians, the mother for the Fu meridians, I told you that in the Chinese perspective, Chinese philosophy says the small intestine is the key to treat and governing to all the yang meridians in our body. At the same time, Korean philosophy says is the triple warmer is the key to control and regulate all the yang meridians in our body. But as per this particular point, you remember the whole body, the central organs are located is the stomach and the spleen, where the central it is located in our body, which scatter the energy across the body, upward direction, downward direction, and communicating, reaching in the form of the nutrition supplement to be given by the spleen itself. So therefore spleen should function means the stomach should function properly. So therefore when activating this point, that means you are activating to all the yang, fu, viscera organs in our body. When we look at about the urinary bladder, look at about the large intestine, small intestine, triple warmer, and also the gallbladder, all are connecting by using single point. So therefore you just activate this point. Whether you wanted to treat for the gallbladder related diseases, that point to be called as a liang men. That point is located tu chun proximal to the ren 12. That point is located on the lateral side. You just apply ren 12, that point towards the right side. That indicates where we call as a towards here. That is the liang men point, stomach 21. Treat for the gallbladder related diseases. When you wanted to treat for the left side, that means for the abdominal related, anything related to the pain conditions or the pancreas and then spleen conditions can be treatable on the other side. When you wanted to treat for the downwards direction, make sure that you are treating to the duodenum. When you are treating to the upward direction, transversely, cutaneously, obliquely, upward direction, needle should be inserted in this direction, then you understand that point is you are treating for the esophagus conditions. Right. So when we look at about the REN 13, that point is called as a Shankwan. So that point is 5 chun proximal to the center of the navel. This point is located on the midline, but in fact this point also treatable for all the esophagus related conditions. One is the esophagus is the REN 13 point, fundus of the stomach that to be treatable for the REN 12, and then the lower portion, the duodenum, the pyloric sphincter to be treatable by activating the REN 11 point is recommended. So if you activate these 3 points together, the Shangwan, Chungwan, and then Siawan, these are the points is always is good to treat for the numerous diseases related to the abdominal system. Siawan, the point is REN 10. Understand that point also good to treat for all the spleen malfunction conditions can be treatable. Right. So when we look at about the another important key point I wanted to tell you, because of all these points are the inferior epigastric arteries which supplies to this particular region, abdominal aorta that is descending from the aorta, that also regulated by activating this point. At the same time, when you wanted to treat for the REN 12, that REN 14, that point is known as a Chu, right? Jue. So this point is located 6 chun proximal to the tip of the center of the navel on the central midline. You remember this is the very key point, but this point is treatable for all the cardiac related diseases. So now you understand this is the move frontal arm point for the heart system, the cardiac system. There are the another point which we call as a Sinsho. That point is 1.5 chun lateral to the caudal border of the spinous process of the 5th thoracic vertebra. The point is located is the UB15 point. When you wanted to treat for the cardiac functions, you just focus bilaterally. That means anterior and the posterior direction. Both the points you are activating together. Always is good to treat for the numerous cardiac related diseases. Do you know there are the 9 kinds of the heart pain the patient gets? Even any kind of the pain. I told you the Shaoshang point, that means is the Shaochung point. That point is H9 point. If you activate the H9 point on the right side, then you are treating for the pulmonary valve. When you are treating for the left side H9 point, that point you are activating to the the cardiac valve. So therefore you are both an aortic valve of the H9 point on the left side. So you are activating to circulate the coronary arteries to the cardiac system. At the same time, you just activate this point if the patient is suffering for the cardiac pain, angina pain or angina pectoris or the myocardial, maybe myocardial infection is kind of the serious condition, is kind of the heart attack. Even that condition also, this as a supplementary point can be recommended until we go for the hospitalization. Right. So therefore you understand when the patient is telling about that I do have the pain on the pectoralis major muscles or the epigastric region, I have the pain, or the abdominal pain, or the left side chest pain or right side chest pain. Even the right side chest pain also leads to the cardiac issues. No doubt that only the problem is the left side hand pain, only the reason to cause the cardiac pain. No, of course on the right side also gets the pain if the cardiac pain is there. So therefore you understand, give the pressure to this particular 2 points to understand where the precisely patient is getting the pain, how the pain is in the stomach, REN12 condition for the stomach and gastric related pain, or there is the cardiac pain. You wanted to know that, you just give the pressure on the REN14, that is 6th tune proximal to the center of the navel. You just try to locate both the points, give the pressure like this. Then the patient says that I don't have the pain on the REN14 but I do have the pain on the REN12, then indicates it is related to the abdominal related issues which leads to this problem. When the patient is complaining I do have the pain on the both the places, that condition is both are involved here. If the patient is complaining only the pain on the particular region where we call as a chu region, then that indicates there is some kind of the malfunction of the heart which leads to this problem. Therefore you just understand, just give the deeper pressure to that particular region, or you just insert the needle slightly upward direction. Certainly there is a relief as well. Right. So until you go and take the opinion of the cardiologist, certainly we do require sometimes is electrocardiogram, or the we call as a known as echocardiograph. So sometimes is the TMT, angiogram, etc. is required. But before that patient is acutely partially affected, then you can treat this, and at the same time this point also treat for the coronary arteries as well. But there are the another point I wanted to tell you, treat for the coronary arteries, that is the right coronary and left coronary. Both the arteries can be treatable by activating point known as a Carling point, that is the pericardium 7 point, right? So in that way you just integratedly you activate the points to regulate that particular system. Of course the point is located on the affected area. Once you apply the needle, patient also feel that comfortable. There is another point I wanted to add up for the cardiac pain. That point is known as a Poulang. Poulang is Bulang, that point is kidney 22. So you just add up this point also to treat for the cardiac pain. At the same time I am coming down the line, you can find another couple of the points that also good to treat for the cardiac issues.